So John, I've been waiting for this interview. I've been here for 2 days looking at what's going on around here, and then suddenly jumped in myself and was involved in what's going on around here. As we've been exploring this subject now for quite some time, and Pain Revealed, and a lot of it has been around cell therapy and rejuvenation type approaches in care. You've really assembled something that is kind of unique here, with a lot of fun toys and processes that people are pretty much raving about. So you're a chiropractor. You started life, I think, as a chiropractor, right? So let's talk about your journey. I mean, how'd you get to where you are and what you're doing today?
You know, I had an injury. I had severe back pain early in my chiropractic career, and it was really a career-ending injury with a car accident. And a colleague of mine had just gotten out of osteopathic school, and he was doing something called prolotherapy, which I'd never heard of. But he promised me that this was probably why I had back pain, even though my MRI showed I had this massive herniation that was pinching on the nerve, and I had pain down my leg. So it was, it really matched what showed on the MRI. But he started to talk to me about how pain can be referred by connective tissue. And he started to talk about how this treatment of prolotherapy created healing events in connective tissue where joints were maybe hypermobile. And I kind of stepped back and said, well, in chiropractic school, they told us to stay away from hypermobile joints, right? You're to adjust the areas that are locked up and fixated. So it really made sense to me that if you can treat the hypermobility, that would be a very complementary, modality in any practice. Sure. But at the moment I was skeptical, and so he told me, hey, listen, let me do a treatment on you. There's lidocaine in this injection. I think it's these set of ligaments, and if it gets rid of your pain, that's pretty much diagnostic. That's where your pain was coming from. Right. So I laid on the table, he did the injections, and the pain went completely away.
That fast?
Just, because the lidocaine was, activated in those ligaments, and so it was not involved with the disc at all.
Wow.
So that was really one of the earlier aha moments for me, realizing that there was something, beyond just chiropractic that could be a huge benefit to, my patients. So I've had probably close to 20 different doctors over the last 20 plus years working with me and for me, doing regenerative injection, and it's just evolved to where we are today.
Wow. Now, what's interesting, because there's some more facets to you, I walk through this office and there's artwork hanging everywhere, so you paint.
Yeah.
So you have this inherent disposition towards art and aesthetics. Do you feel like somehow that translates into how you organize this clinic and and the patient care that you give?
Well, I think that healing is an artistic expression, and I think there's an intuitive aspect of healing, and sometimes, an earlier teacher told me his definition of intuition is the ability to respond to low threshold input accurately. The key to that is accurate. And sometimes you don't know where that intuition's coming from. It might be the way a patient's walking, or the way that they're antalgic or kind of off to one side, or there's something that they tell you, and it just all these subtle cues, and you're following your intuition. You don't realize that there are very specific things that you're picking up on that are leading you to those, ideas that might involve, a various treatment plan that might work for that patient.
So I bring this up for a reason, because you said healing, there's an art to healing. And so often people are looking at kind of an A to B direct link between, okay, here's this intervention, here's this outcome, and there's this thing called a person in the middle of all this. And you kind of said it, there's just things that you pick up that might be subtle that will influence your thinking. It's not like you run a production line through saying, okay, everybody comes in, knees, backs, shoulders. It's like there's a little bit more nuance to this, and I think that's a part of what I noticed when you're thinking and approaching your patients. So is that something that you can train, or is this something you are?
Well, I think that there's going to be some people that are going to have it, and some people aren't. It's like, the artwork that I do, sometimes when I'm looking at my art and I'm painting, I just think anybody could do this. Like, it's a matter of just, wanting to do it and having the desire. But ultimately, I think everybody has a unique set of skills that can be expressed depending on where they're going to put their efforts.
Right.
For me, it's healing.
Yeah, and I think in the end, it's the fundamental thing. It's not it's healing, not a procedure, but healing is the thing that you're after with this, right? So now, looking at your background, you also went and did some additional postgrad training in neurology. Mm-hmm. What did that teach you?
It taught me that we're a very complex being, mm-hmm. And there's a lot of complexities with regards to the nervous system in particular, and how the nervous system controls so many aspects of health. Mm-hmm. And many things that I once thought were really more structural really are more of a neurological consequence. Mm-hmm. And I'll give you an example. You being a chiropractor as well, you probably would remember if you're working on a patient and you're like, relax, and
right.
they just can't quite relax.
Right.
And it used to get very frustrating because you're like, well, why can't that person just relax? Because they need to be relaxed to get a very smooth adjustment, like right. on their neck or back. Mm-hmm. And so starting to learn about and delve into the neurology component, you start to realize that there's a vestibular component. Mm-hmm. And there's a conversation that happens between the inner ears, the eyes, and the neck muscles. Mm-hmm. And it's a very complicated conversation that needs to be very well communicated. Mm-hmm. In order for, if you think about it, you turning your ear to the right, the eyes move to the left, right. The inner ears, the position of the head. And so that gets confused, and then what the result is you have very tight muscles.
Right.
So working with the neurology, you start to learn that you can do some of these very subtle exercises with people to rebalance those things and get this supple aspect of the spinal muscles that then the adjustments are like butter.
So with that understanding, and then looking at the varying modalities that you offer here, there's quite an array. And having now been on the receiving end, getting exosomes through an IV push, but then next thing you know, there's a laser, an optic filament that will conduct laser light put into the IV that I can literally see glow through my arm from under the skin. Yeah. So why do you use that? What's that about?
Well, LumiStem is an opportunity for us to directly laser cells in the body mm-hmm. and bypass the skin. Mm-hmm. And the skin was really designed to reflect light. It's to protect us from the sun.
Right.
So most of all of the laser light would be absorbed in the first millimeter of skin. So right. although we use very powerful lasers to get some deep into the body, it's minimal by the right. time it gets in. But if you can bypass the skin, and say you wanted to laser like the bloodstream, mm-hmm. You're going to have all the red blood cells and white blood cells and cytokines. They're going to be irradiated, and the various spectrum of these lights has some amazing, abilities to transform that blood into something much more healing and, mm-hmm. Quench inflammation, mm-hmm. improve autoimmune conditions. The entourage effect, where 1 + 1 = 4.
Right.
Right? So using different modalities in combination, I found to work better than each individual would by itself.
So I've seen that. I also see another device, they call it the 10-pass. Can you describe what that does?
The 10-pass, I think I briefly had talked to you about my personal journey with Lyme disease and mm-hmm. chronic mold illness. I was very sick. And there was points where I was a very successful naturopath and chiropractor, and I had patients literally coming to me from all over, but I was sick.
And let's talk about that, because you also studied naturopathy, and you have a degree in that.
Yes.
You seem like you enjoyed academics for some good part of your life, it seems.
I love it. I love to learn.
Yeah. So after being a chiropractor and also a naturopath, that's when you were sick. And
that's
this
right.
was mold or Lyme, both?
Well, at first, I didn't know. Mm-hmm. Probably it was a good 8 years that I was just searching, mm-hmm. and people were telling me it was in my head, and so I got very hard into meditation. I was meditating an hour a day, and I just had no idea what was wrong with me, and nobody could help me. I went to experts all over.
What kind of symptoms?
Just chronic inflammation. Mm-hmm. I had joint pain that was just severe. Mm-hmm. It was crippling. Mm-hmm. And I wasn't really able to do much, activities. I was a kite surfer. I was one of the first people to start kite surfing on this coast, and we were doing jumps 20, 30 feet and spins and flips.
Wow.
And so I went from that level of physical activity to I couldn't do anything. And I had a weight about 150 pounds, no, zero fat. So I looked like I was about 60 years old.
Wow.
And a lot of people were really, really worried about me because, it affects your psychology. I mean, this is a documentary on pain, and I knew pain. Pain was my very close friend for many years, and I know how devastating it can be, and it can transform your personality, and it can become a huge block for personal growth. If you want to put somebody in a position where they're going to revert to when they were a little kid, put them in a lot of pain.
Yeah.
Spiritual growth, very difficult. If you're trying to focus on being right in the moment, and in your body, but all you can, appreciate is pain in your body, is very difficult. So I knew that for many, many years. And I remember watching people even just walk or run or doing workouts, and I'd be like, I can't imagine myself being able to do that. 10-pass is what brought me back.
Really?
10-pass hyperbaric ozone. And I had done regular IV ozone, and I was getting results. And that's, after I figured out my diagnosis with Lyme disease, I started to do modalities. At first, it was IV antibiotics, which were temporary, and then I would get sick again. And then I started to use the ozone infusions along with colloidal silver infusions that were very long. These infusions would last for about 6 to 8 hours.
Wow.
And I had a PICC line. I probably had 5 PICC lines. I would have a PICC line for a few months, and I would have it taken out. I would another PICC line. And it was really kind of dolphining between feeling good and just feeling terrible. So when I started doing the 10-pass hyperbaric ozone, it really moved the needle for me. And 10-pass has a reputation as a modality that can really cure Lyme disease.
Wow.
And for me, it worked great. That, along with some lifestyle changes, some dietary changes, some Chinese herbs, it got me to the point where I was really knocking on the door of being normal.
Do you deal with a lot of people in your practice here that have Lyme?
I do.
Yeah. It's interesting
From
how...
pain to purpose.
Yeah, from pain to purpose, right? As my friend Dr. Pompa says. Is there a blessing in your challenge in the sense that now you have a better sensitivity to be able to help other people who are facing similar things?
Absolutely.
Yeah.
I mean, the best insight is to get it down in the trenches.
Yeah.
Really, there's so many different aspects of just disease in general, and I see chronic Lyme and chronic mold illness as being an absolute epidemic.
Yeah.
I think that there are a huge amount of diseases that people are living with that they have no idea that this is really at the core.
Well, let's talk about that for a minute. So what are typical, and you explained what your symptoms were, and I can't tell you how many times I heard this through this whole docuseries. People told me it was in my head. They couldn't identify what was wrong with me. I started to think I was crazy, and very similar as far as the pain was debilitating, and there's no quality of life there anymore. And then some got lucky enough to find someone who said, no, I got you. I know what this is. There might be a lot of people right now who are in that they haven't found their solution. They haven't been given that little bit of hope that can open them up to new possibilities. So if it is mold, if it's Lyme, what are they missing right now, or what are the doctors that are providing for them missing right now?
Well, I think most every doctor or healthcare provider would agree that inflammation is really at the core of just about every disease, and when there's a lot of inflammation, there's a disturbance in the body's ability to maintain homeostasis, or oftentimes, you'll hear me say you're either a swamp or a river, so we want to be more, clean, things need to be bringing in the groceries and taking out the garbage, right? The cells need that, and there's various effects that stagnation can manifest itself with, and it's amplified to a huge degree with someone that has mold illness or Lyme, and oftentimes they'll have both because you just can't detox, and my personal views are that there's about a quarter of the population has a certain set of genes, and we will test patients for these genes. And they can't cleanse and detox normally. So pesticides, heavy metals, a lot of man-made chemicals, and then the biotoxins. And biotoxins can come from mold, they can come from Lyme, any type of microbial, effect. And where that gets stuck is in the cell membrane. And the cell membranes don't turn over except every 2 years.
Right.
So this basically, you have the environmental influence that's coming in and it's hitting the cell membrane, and that's transcribed down to the nucleus.
Right.
And so that message gets skewed, and so then you have this, inflammatory response. They call chronic inflammatory response syndrome. You'd ask me what type of symptoms, if it's in the brain, that could be a unique set of expressions based on that person's genes. It could look like Parkinson's or Alzheimer's. Dale Bredesen, a very well-known physician that wrote a book called The End to Alzheimer's. He talks about the different etiologies of Alzheimer's, and one of them is infection. So this isn't just, the chiropractors and the naturopaths, beating their chest about, hey, inflammation's at the core of a lot of these degenerative neurologic disorders. This is real stuff. This is real science that's now showing that that's what is causing a lot of these beta amyloid plaques and tau protein and so forth. So neurological diseases, could mimic, an expression of these infections. A lot of inner ear conditions, arthritis, especially arthritis that doesn't seem to go away. It could be worsened with sleep and rest. Like, normal arthritis and pain, you can get massage and you can get modalities and it gets better.
Right.
But a lot of these kind of mold and Lyme pain syndromes, they don't respond like normal pain syndromes do. But they can be made worse with activity, don't get me wrong.
Right. So I noticed, and as you're describing some of these things, you also have hyperbaric oxygen here. So why that?
Well, we have a couple of forms of oxygen therapy. We've got the hyperbaric oxygen chamber, and we also have something called CVAC.
I was in that yesterday, yeah.
Yeah, and the CVAC is really the evolution of hyperbaric. There's a very expensive machine. There's only 55 in the world.
Wow.
We have one here at the center, and these will alternate pressure. And, we talked about being a swamp or a river. Well, there is no modality that's more powerful to move something called lymph. Right. So lymph is like your body's gutter system. The lymph is a fluid that's a result of, so the blood's bringing nutrients to the tissues, right? And then out of the bloodstream into the interstitial space, the area around the capillaries. And the nutrients gets into the cells, and then all that waste products has to go somewhere.
Right.
And that's where it dumps into this lymphatics. So if I were to take away everything but your lymph, there would be a perfect, hologram of you. And so the lymph is everywhere.
Right.
And so if you take and put you through alterations in pressure, it's very powerful to move that lymph, so moving you more towards being a river.
Has sort of a pumping effect, so it creates movement.
Yeah, it increases mitochondrial biogenesis, which is your body's cellular battery, which is the energy that you need to heal, and maintain all the different functions of your body and your cells. So it does that, and it's been shown to actually increase your VO2 max significantly with just sitting in this pod.
I say it's passive. You're not doing anything, but the technician who was there said, it's like you just had a whole workout, and I'm like, just sitting here, and they're like, yep.
And it's perfect for people with chronic pain because, a lot of our patients, they're not triathletes. They're not Ironman. I mean, we do see those patients, but the average patient we see has a hard time going to the gym and working out because they're in pain.
Right.
So the CVAC has been a godsend for us to be able to rehab people to the point where then they can start working out normally themselves.
And so you have cryotherapy also?
Oh, cryotherapy. Yeah. Love it.
I love it. You're excited about everything you do, which you should be.
Yeah.
So tell me about the cryotherapy.
Well, the cryotherapy, it's called whole body cryotherapy, right? And it's a chamber, and you get in this chamber, and your head is sticking out the top, and nitrogen gas swirls around, so you're basically only wearing booties and gloves.
Right.
And men are going to wear, their underwear.
Right.
Women, it's optional. So you're practically naked in this contained area. and the air goes down to negative 250 degrees.
The air?
The air, 250 degrees.
What does that feel like? I didn't get in that yet, so what does that feel like?
It's very cold. It's very cold.
I'd assume.
But the good news is that it only lasts for 3 minutes.
Right.
You know, and you know, if you think about if you were put in a really cold environment, and you know, back in the day, we didn't have, you know, heaters and, you know, air conditioning. We can totally control our environment.
Right.
We had to take the blunt force of nature, and it's unimaginable for you and I to think about enduring a winter without the, you know, these big coats and being able to go and sleep in a warm room. But we didn't have that luxury. So the genes that we are naturally born with and we have are expressed to be able to buffer that cold. And we do it by creating heat. So let's say we were to trick your body to think that it was 100 years ago and you had to live in that environment. And that's what we do in that 3 minutes. So, but yet you don't have to produce all that heat. So your body's then saying, wow, I've got all this extra energy. What am I going to do with it? Wow, this ankle needs to be healed. You know, the heart needs some healing. The brain.
So it activates some genetic expression that can be channeled toward healing.
So it's a systemic effect. Now, there are some local effects, right? Cold therapy is used in a lot of instances for you know, reducing inflammation locally. But when it's done systemically, you get this systemic effect that really is a special effect that we like to utilize here, because when we start applying regenerative medicine, you know, we're looking for modalities that can support that. We're looking to activate those genes, you know, so that person can really dig deep at a cellular level to heal those chronic injuries.
And so somebody with pain, you're going to reduce inflammation, activate these effects, and it could have their pain resolve.
That's
simple.
what we see every day.
Yeah. Well, talking about what you see every day, so it seems that, you know, I've spoken to some of your staff, you know, the results as far as the percentage of people that really get pretty robust results here is high. How are you seeing it?
I'm surprised when we have someone that's not getting results, you know, but I make sure that those people are, you know, looked at, and there's always something. You know, I have the personal belief that we can heal every single person, you know, and maybe that's a shortcoming for me, and sometimes it causes me some stress because I'll be up at night in the weekend, you know, thinking, oh, the patient, what could I do? Like, what's different, you know? But I do believe if you can get the right combination and figure out exactly what that patient needs, that healing is a possibility for everybody.
And that's the premise to start with, right? Is that it's a possibility, at least, for everybody. Because if somebody's hopeless, you know, then why bother doing anything? So you have to start there. So you see yourself a bit of a safe cracker then. So what's the combination for this one to get it home?
Yeah.
That's interesting. Now, a lot of stuff that you have here is kind of new and innovative, right? So it seems like this field is constantly, I don't say shifting, but it's evolving. Yeah. So how do you stay current? I mean, you know, new things come on the market, like, okay, the CVAC comes out. Okay, well, you know, we're gonna get one of those, and you know, there's not that many in the world, but this is something I like. So how do you curate for your protocols here?
You know, that's a great question. I don't have a good answer. I think I've been lucky. I know that with my personal journey with Lyme and chronic mold has brought me to a lot of modalities. And I think that when you have the intention to find those modalities and you're looking for answers, you're a seeker.
Yeah.
You know, these things appear. So, but I don't have like a recipe that I follow.
Yeah. It's just you're kind of on this journey, and you see where it leads, and it's could be somewhat unexpected. What's the biggest surprise or unexpected thing that you've seen happen here in your practice?
We see a lot of elderly patients here, you know, and we've had some patients up towards, you know, late 90s and even 100.
Wow.
You know, and some people might think that even at that age they might not have the regenerative capacity. You know, and I'm thinking of one particular patient in particular, and she was 97, and all she wanted to do was walk the beach. You know, and so we did one of our flagship treatments called Maripose, where we combined bone marrow and adipose and honey matrix, and it was her knees that were the primary, you know, problem. And just hearing that story, that she was able to walk the beach, without her cane and without any assistance, I think that's surprising to me at the time, because, I think the limitations that we might place on people for their age or, their weight or, whatever limitations you might think of, I think can be overcome with, as we said before, the right, combination, to crack that safe.
Yeah. So does it keep you motivated every day? I mean, looking at the work you're doing, seeing the results, does that like get you up in the morning with a purpose, feeling like I can't wait to go see what's going on today?
Well, my schedule is a bit different than most. I'm up at 3:30, 4 o'clock every morning. And
by discipline, or do you naturally wake up?
I wake up and I'm excited. I wake up and I spring out of bed, and I like to take that time to. I have a hot plunge and a cold plunge, so I have a bit of a ritual where I'm a big fan of cold therapy. As we talked about before. So I do that, and I'll do about an hour of meditation. After my meditation in the morning, my mind is turned on, and I'm ready to get on the computer and start to communicate with patients and colleagues and searching different publications. And I get excited about learning more and seeing how we can make things even better than they are. I think that would be kind of my constant self-talk, is how can I make that better, and that really juices me. Yeah.
So a lot of what you're doing is considered, some people might call it innovative, some people might call it cutting edge, some people will call it alternative. How far away from being sort of mainstream do you think the type of work you're doing is, or do you think it's not there yet?
Well, certainly if we were to project ourselves 100 years from now, we'd probably look back at what we're doing now as completely barbaric.
Yeah.
I mean, look at like in the 1940s and 50s when the first joint replacement was done, right? That nobody thought that was going to work. Even all the orthopedics were like, that's ridiculous. And insurances didn't pay for it, right? But now it's the standard of care.
Right.
So I'm certain in 100 years they're going to be digging up bodies with these pieces of metal saying, look, what the heck were they doing?
Right.
For me personally, when I first discovered ultrasound-guided regenerative treatments, where we're able to actually see what was wrong, because I think that's incredibly important. You got to, see which ligaments, which tendons, which aspects of the joints are damaged, and then being able to guide the needle to the precise area. I had been paragliding in Hawaii, and almost, had a more severe injury, but it was to my wrist. I came down on a lava rock. Ooh. And back then I was doing a lot of traditional chiropractic, and anybody that knew me back then, I had a wristband on, and I tried PRP several times, and it didn't work at all. And then I had a colleague that was starting to play around with ultrasound-guided PRP. And she was a medical doctor from Los Angeles. And when I went to get the injection from her, she had a man that was doing the ultrasound guidance, and he turned out to be a chiropractor as well.
Wow.
And it worked great because it was guided right to the right spot in my wrist. So I never had a problem with my wrist since then. Wow. But it was my second big aha moment, because I'm like, this is the future of medicine. At the time, nobody really heard about it. Right. But this is like 12, 14 years ago, and now I'm looking around and it's starting to become more and more popular.
You're right.
Where people are starting to catch on. So I think that the average person out there is not okay with taking a pill. Right. I think that there's starting to become a big shift with our population that is seeing, the pharmaceutical companies, and the drug paradigm as it's not the answer. You're not fixing anything.
Right.
And regenerative medicine is becoming more of an alternative for people that will become more of a standard of care as we move farther into the future.
And you've certainly been integrated with all these things, stem cells and now exosomes, that you're utilizing. How do you see that particular area unfolding in the coming 5 or 10 years?
If I knew that, I'd probably be a billionaire right now. I tell you, I did learn about exosomes probably a decade ago. I knew they were being studied, and now they're available. They were completely unattainable, when I first heard about them. They were very exciting, the exosomes. So now we're able to source them, very quality, in very high concentrations in the tens of billions per cc.
I was going to say, I think you put 10 billion into me yesterday, right?
Yeah.
And a little laser light afterwards. And so it's pretty amazing that the technology sits where it sits. So is it happening faster or slower than you expected? Because you said 10 years ago I knew about this. Now here you are, routine utilization. So do you think the pace is accelerating?
It feels like that.
Yeah.
Yeah, it does. It definitely feels like, because I think, like what I said earlier, is that the demand is there. I think people are looking for something that is more curative.
Yeah.
Something that's more of fixing the root problem.
Right.
This is the chiropractic philosophy. We've been talking that since chiropractic school, right? It's like, fixing the subluxation, which is at the cause of the problem, versus taking a pill that's masking the symptom.
Right. And the idea of regenerative thinking as compared to symptom manipulation, right? That's really the contrast, isn't it? So, the body does self-heal, and if there's things that facilitate regeneration, isn't that what everybody would want? So it's really fascinating to watch it unfold.
Yeah, if you had a choice between a joint replacement surgery, right? They're going to basically rip your joint out of your body and stick this big hunk of metal, right? Extremely painful, for probably a good amount of time afterwards in rehab. And then you've got the disability associated with that, versus an injection where you're sore for a day or two. And if the results could even be better with that injection, who wouldn't choose that?
Yeah.
It's a no-brainer.
Not to mention the severity of the drugs that you're put on to manage that pain, and that whole road that it could lead you down, which is not a very pleasant thing.
And then, what types of leaching of some of that material into your body and into your bloodstream, and the effect that may have in the energy, and the acupuncture meridians through the body. There's just so many things that we don't know, and as we're moving forward into the future, we're starting to realize, oh wow, that wasn't such a good idea.
Yeah, so now we've had this conversation, and certainly thank you for letting us come here and observe all the different things that are going on. And tomorrow you'll be up 4 o'clock again, excited about this and ready to do it all over again. Doesn't get old, huh?
Now that I got your cell phone, you're going to get a text.
Oh, good.
Hey, I got this great idea. What do you think?
Expect a couple hours before you get a reply.
Okay.
Especially because it's 2 a.m. to me where I live.
Definitely.
I might be awake, actually, at that point. Anyway, John, I really appreciate you taking the time with us and opening your doors and allowing us to really critically observe what's going on here. I really appreciate that.
Patrick, it's my pleasure. Thank you.
For more information about these exciting regenerative therapies, you can find us at advancedrejuvenation.us. You can also contact us by phone at 941-330-8553 or email us at info@advancedrejuvenation.us. If you found the information on this video helpful, please like us and share us on Facebook. You just never know whose life you might touch. Well, thanks for joining us. And remember, if healing is possible, consider it to be within your reach. Bye for now.